Oh, àgbáṣòro dà, Ọlọ́run má jẹ́ á dàgbà dààmú. Old age. What is that thing peculiar about old age? Why are people afraid of old age? And those in those ages, what are the challenges they are going through? You know your parents, your grandparents, what they are going through. Don't pretend that you don't see. It will soon come your turn. If only you go to that age. What are the challenges of old age? We are looking at 10 major challenges in old age and their solutions. Hey, it doesn't come easy. Challenges in old age and the solution. We have discussed brain. The same problem of this brain will lead to poor sleep. Your grandparents can no more sleep for long hours again. They tell you they sleep 9 o'clock, they are awake 12 o'clock, they will not sleep till morning. They have finished all the sleep they came with from heaven. They can go into depression, especially if they lose one of their children or something very valuable to them got missed or got spoiled. They are in perpetual fear and anxiety. This leads to social problem of old age. What are the social problem of old age? They are now abandoned in some situation, or they are not considered in matter that matters. They live alone, loneliness, and that is the killer of old age. You talk of social exclusion. You are planning a party, then you felt grandfather doesn't need to be there. He's not involved. These are social challenges of old age. Solution. Involve mothers and fathers in social events and gatherings. Allow them dress well in their formal regalia, in the biggest of their dresses in a beautiful way. Bring them to the party. Bring them to occasion. Let them attend lectures. Let them be in the places where other people are. Let them see other old people like themselves. And that goes a long way to relax their mind. They feel good that, oh, I am not only the one living the game. There are other old people around. Challenges of old age can be dealt with by you and I. Organizing a party for the elders of a community can go a long way. And I drop this with you. The same thing we do every year. This is the 9th edition of this same program. Parents 70 years and above are gathered and they are entertained. They are checked up medically and they are encouraged to live a longer life and live a healthy life. Bring your father and your mother. You might be doing a good thing to them. Again, old age has social challenges. Prepare to take care of them now, otherwise, look at that video. The old man walking on the streets. And what happened? He fell. An old person socially should not be walking alone at that stage because he might not be seeing very well. He might not be hearing very well. He's frail, he cannot even run, he cannot jump the gutter very well. And such people can fall. And when they fall, they go mute. That is stroke of aphasia, inability to talk. Number 5, bones. Let's get this clear. In old age, bones are weak. The weakness of bones is different from a diseased bone. Arthritis, osteoarthritis, and rheumatic bone disease are disease. I'm not talking about medical challenges of old age. I'm talking about old age challenges, meaning that due to age and aging, changes that occur, the bone has undergone what is called resorption. Resorption means demineralization. That means the content that makes it strong and heavy have washed it away, and therefore it's not strong again. Our grandmothers, women are at risk of bone fracture without a fall. Take note of this very well. Women, our grandparents, mothers are at risk of a fractured bone, even from sleep, without fall, without accident. And that's because once they arrive at the menopause, the rate at which bones get weakened is faster than in men. And that means that such women are susceptible to experience what is called bone fracture without accident. What's the solution to this? Parents and grandparents should know that you do not cross gutter by jumping. 2. You do not climb staircase all the time. 3. You do not walk on slippery environment alone without somebody supporting you or holding something. And 4. Ensure you know where you are going, especially at night. And finally, for those of our parents that have big weight, it's an opportunity to reduce their weight. Otherwise, they'll keep having lumbosacral spondylosis. You may not bother about that word. But it just means that the bone in the back towards the bum side, the lumbar and the sacral bone that have carried the weight over years, as the wear and tear has damaged them, and they are in perpetual pain because there's compression on the nerve that's emanated from those bones. And so that pain radiates from the bum down to the knee, down to the ankle. And they tell you as if they feel that something is moving, or something is peppery, or something is vibrating in the leg. Nothing is there. There's a compression on the nerve around that area. So you can reduce your weight and manage pain better. Physiotherapy can be useful in this stage. Number 6, breathing problem. This chest of elderly people is very weak. We call something respiratory muscle and accessory muscles. These are the muscles that runs on the chest, on the ribs, that helps us to breathe very well. When you are in your old age, those muscles have relaxed so much that ability to inhale, breathing in is so easy. The ability to exhale is difficult for them. That was the reason. During COVID, you are told don't allow the elders to come out. Why? Most of you did not ask the question then. The reason is that if for any reason inhale the COVID, they cannot get it out from the system. When they sit down with smokers too, they run problem of chest infection. They are prone to chest infection because they cannot exhale effectively. So our grandparents can have pneumonia, community acquired pneumonia is common with them. Tuberculosis is common with them. Other chest infection is common with them. And for those of them that smoked before, having lung cancer, bronchiectasis, atelectasis, and all the chest problems that belongs to COPD is very, very common with them. You do not want a parent to come down with any of this. It can be very devastating because they keep coughing, they keep running fever, and they keep having weakness and they are tired. Old age is very difficult. These changes can be very terrible. Prevention. Most of the time they wear something to cover their chest. Yeah, parents in Yoruba land are very smart. They put some clothing and say, this is very correct. Because they cannot actually exhale effectively. Let them wear something that provides warmth to the chest. Again, let them use face mask where it is necessary. And let them practice what is called deep breathing exercise. That can go a long way to strengthen the accessory and respiratory muscles. Number 7, skin. Everybody knows. You are seeing me today. See me in 25 years to come. This place will have wrinkles. The muscle here will have wrinkles. The muscle of the mouth will have wrinkles. Wrinkling of skin is an evidence of old age, meaning that age wrinkles the skin. Number 8, abdomen, the tummy. Don't forget we are looking at the head to toe. In the tummy, grandparents comes to complain. I cannot eat like before. Doctor, I'm losing weight. Let me check. What is wrong with me? I don't even know why. Don't get bothered. Let me warn. Do not go and take any blood tonic at the age of 75. You want to make the man or woman run into cancer disease. It's been found that elderly in their 60s, 70s taking folic acid or any drug that contains folic acid predisposes them to have cancer. So do not go for blood tonic. Rather, try to understand our discussion in this episode. You can share this with your friends. The abdomen contains the stomach. Stomach is where the food settles when you eat. That stomach is made of muscle. It will have shrunk, smaller than before. Now it can no more take much food like before. Therefore, when they take food to a certain stage, the tummy is full, the stomach is full, and they have to stop eating. And in reverse, that turns to weight loss. So they do not have enough food in their body system. The kidneys has worked for over 75 years. Ability to manage urine, produce urine, managing waste products in the body also is slower. You can notice some leg swelling. Sometimes they are not disease. It's just weakness in the kidneys, and they can recover if you get it right. Again, still in the abdomen, you talk of the liver. Liver produces the gall secretions from gallbladder or rome. Their own is weak. When they eat food that contains a lot of oil, they run into trouble. They can have gastroparesis. They can have constipation today and have diarrhea tomorrow, and have constipation next tomorrow. That means the intestine is not really working effectively. Beyond this, they can also develop what is called splenomegaly. Spleen are more, can become enlarged. And when that happens, their blood level will go down. And you begin to look for blood tonic. No, you don't need it. This is a man that has treated malaria for over 100 times in life. Those malaria have succeeded in creating a vacuum, a sequestration process into the spleen, and end up not having enough blood in the body system. At that level, for abdomen, let our parents live more on fruit and vegetables. When they live on that, they'll be able to eat more, and they'll maintain a good health, good weight, and a good look as the age defines. So you can do better for elderly person in case you have one in your domain. Number 9, we want to look at old age of the genitals, the private part of an elderly person. The natural tendency at old age is reducing sexual drive both in male and female. Of course, we all know that. For such a system is natural. So, and that's why we warn our 65-year-old men and 70 who are looking for aphrodisiac performance medication to do what again? No, because you are already at certain challenges. Among other challenges of this age of low sexual drive is also changes that can lead to prostate enlargement in male. The prostate is a natural organ that supports erection, that supports sperm production, that supports fertility. Now, at a certain age of life, 65, 70, 75, or 80, depends on your family, that organ has enlarged. It's not cancer, enlargement. Enlargement is normal changes of old age. But that enlargement can come with problem of urine, either urinating frequently or having urgency, inability to hold urine before getting to the toilet, or feeling of incomplete void when you urinate, stay there for long because you think that the urine has not finished. All of this can be problem in the old age. Sometimes you can urinate blood. All of this can happen to men in their 70s and 80s. What are our mothers? There is the problem of uterovaginal prolapse, UV prolapse, uterovaginal prolapse, the womb that carries baby over time. Especially for our grandmothers who had about 3-4 children, and one of those children, or 2 or 3 of them, were about 4.2, 4.5 kilograms at birth. Such grandparents are at risk of feeling that something is trying to come out from the private part of an elderly woman. She's worried. She comes around to tell you that, hey doctor, that something is walking out of my body. Nothing is walking out. It is the same womb that delivered those of you that are ministers and whoever you are today. That particular womb is now lax. All the muscles that hold it up there have relaxed. So the womb is trying to come out from the vagina. When that happens and the prostate enlargement, what is the solution? Solution is that for the men, you will need to change your diet to a lot of fruits. There are food that will assist an elderly person to maintain a good prostate size. 2, physical exercise. There are exercises that an elderly person needs to get engaged in that reduce the enlargement of the prostate. For our mothers too that have prolapse, They can also engage in Kegel exercise that will assist like our men as well. And they can also use a pastry ring or Hodge pastry ring that can push the womb back to its right position. So all of this can be done to help our elderly. And again, old age is not easy to beat. Prepare for it before it becomes a challenge. Number 10 of challenges in old age. Our grandparents and old age suffers so much in this society today. What do they suffer that should be of concern to every one of us in old age is their incoherence. I go back to the brain function. There's incoherence, there's slowness. Okay, these two challenges have led to why some children have abandoned their parents. Their incoherence can be that bad that you are mistaking your mother to be a witchcraft. There's nothing like that. The brain undergoes what is called auto-reverse. That is similar to dementia or to Alzheimer's disease. Do not abandon your parents because of her incoherence or her inconsistency. When it happened to a father, he said he's just being stupid, like some children will say. When it happened to the mother, somebody will tell them she has become a witchcraft. A mother that did not kill you as a baby cannot suddenly become a witchcraft. Do not let anybody deceive you or disrupt your mind. All the age challenges can be overwhelming. So until our next episode, please can comment, ask questions on our page. Share this particular video to others and then let's think together how we can help our old ones. It's getting out of hand that grandparents are dying on the road, in the bus stops, in public places because of lack of care. Nobody is giving them attention. Where is government? No ministry of old people. And yet we have so much fun to waste in our society. Where are the community leaders? Where are the religious leaders? Where are the youth? Who are going to become older tomorrow? What are you doing? Children of old people, what is your plan? Do you abandon your parents to suffer to old age? Remember, your children are looking at you. The way you treat your father, the way your children will treat you. Thank you for listening.